Hello, my name is Belissa. I'm a therapist, counselor, author and coach who has provided support to the prescribed drug injured for more than 2 decades. In this final part of my 20 Years of Hope mini-series, I want to speak from my heart about something that has been weighing heavily on me: the safety of the most vulnerable people in the prescribed drug injury community. Before I begin, I would like to say that nothing stated here is meant to be accusatory or critical of anyone. Nothing is directed at any individual, group, coach, forum, or anyone providing support in any capacity. It is my attempt at being a voice of reason, giving a factual reflection of what I witness daily based on feedback and confirmation from the people I support. Over the past 2 decades, I've seen the community change in many ways. Some of these changes have brought greater awareness and validation, but I've also become increasingly concerned about the volume of advice, theories, protocols, predictions, and commercial promises now being directed at people who are already frightened, sensitized, and in deep distress. In the early years, when there was very little recognition of benzodiazepine, antidepressant, Z-drug, gabapentinoid, opioid, and other forms of prescribed drug injury and neurological dysfunction, people were vulnerable because they were not being believed. They were often dismissed, misdiagnosed, or told that their symptoms were simply anxiety, depression, relapse, personality, weakness, or imagination. There was very little validation, very little professional understanding, and very little support. I know that this is still the case for many, but slowly things are improving. Back then, the information that was available tended to come from a smaller number of careful, experienced sources. Professor Heather Ashton's work, for example, became a lifeline for many. Others who had spent years listening to withdrawal experiences and collecting anecdotal evidence also helped to provide a sense of stability, reassurance, and perspective. Information was containable, and in many ways, this made coping less complicated. Today, however, we have updated and more accurate information regarding nutrition, ways of tapering, supplements, and much more. And with this comes an outpouring of opinions, resulting in numerous debates and, sadly, gaslighting of each other. As a result, I believe we are facing a different kind of vulnerability. The problem is no longer only that people are being ignored, the problem is also that they're being overwhelmed. There are now many voices speaking, offering differing and often conflicting advice. Doctors, coaches, naturopaths, functional medicine practitioners, homeopaths, acupuncturists, wellness influencers, supplement companies, neuroplasticity programs, trauma specialists, mind-body practitioners, and people with personal recovery stories. These voices are well-intentioned. Many are thoughtful, humble, and helpful. Some approaches may offer valuable tools. I believe practitioners genuinely care and are trying to understand. Despite this, based on the increase in crisis management resulting from misinformation, I am increasingly concerned about the safety of the most vulnerable people in this community. This is not an ordinary audience. People affected by prescribed drug injury are not simply reading health information from a calm and neutral place. Many are sleep deprived, frightened, physically sensitized, cognitively impaired, emotionally overwhelmed, and living with symptoms that are terrifying. Some are experiencing akathisia, intrusive thoughts, depersonalization, derealization, despair, panic, agitation, even suicidal ideation as part of the withdrawal picture. This matters. It means that words and advice given to clients or patients in a non-withdrawal setting affect our people in a different way. A statement that might seem like ordinary professional opinion to the person writing it can sound like a life sentence to someone in acute suffering. A prediction that sounds scientifically cautious to a practitioner can feel catastrophic to someone who is barely holding on. A theory that is offered casually can become a source of terror. A comment such as, "Because of your age you may not heal fully," or "This is permanent," or "Your nervous system has learned this," or "You need this particular intervention or you will stay stuck," can destabilize someone very quickly. Those of us who offer support must never forget this. In this healing process, language is not just language. It can be stabilizing or destabilizing. It can preserve hope or collapse it. It can help someone get through the next hour or make the next hour feel impossible. Hope is part of safeguarding. I cannot say this enough. Hope is part of safeguarding. I am not talking about false hope. I'm not suggesting that anyone should make promises, deny suffering, or pretend that healing is always quick and straightforward. But responsible hope matters. Hope does not mean telling someone you will be completely fine by next month. Hope means saying, "Many people have reported severe and frightening symptoms like you are having now, and in my experience, they improved. Your body is still working on healing." We do not know the full timeline, but we do not have to assume the worst. Let us focus on helping you get through this moment safely. That kind of hope is not wishful thinking. It is protective. For people who are severely symptomatic, hopeless predictions can be dangerous. This is especially true when predictions come from someone perceived as an expert, clinician, doctor, researcher, or authority figure. If you are someone who offers support, please understand this. The people reading your words or listening to you may include individuals who are at high risk, very high risk. Some may be reading your post at 3 a.m. after days without sleep, while experiencing akathisia, terror, or thoughts of not wanting to continue. That reality should shape how we speak. Correlation is not causation. Another concern I have is the way certain concepts are being applied too rigidly or too simplistically. One of the most important principles we need to remember is that correlation is not causation. Just because a person reacts after taking something, it does not always mean that substance caused the reaction. At the same time, just because something is not known to act on one particular pathway does not mean it is automatically safe for everyone experiencing this healing process. This is not black and white. For example, some people can look at a list of GABAergic supplements or medicines and assume that anything on that list will inevitably cause problems. Others look at a list of non-GABAergic supplements or medicines and assume that because something is not GABAergic, it must be safe for those experiencing benzodiazepine and Z-drug withdrawal. Both assumptions can be misleading. Withdrawal sensitivity is complex. People can react for many reasons: nervous system sensitization, histamine responses, metabolic changes, stress, fear conditioning, sleep deprivation, hormonal shifts, immune activation, interactions, doses, timing, individual biology, or sometimes reasons we simply do not yet understand. This does not mean people should live in fear of everything. It means we need discernment. We need to stop turning partial knowledge into rigid rules. We need to stop frightening the people we support with ultimatums. We need to stop presenting theories as certainties. And we need to be able to say, I do not know, or this may be relevant for some people, but it may not apply to everyone. The danger of one-size-fits-all explanations. Another issue causing confusion and distress is a tendency to take one useful framework and apply it to everyone. Neuroplasticity, brain retraining, trauma work, somatic practices, acceptance and commitment therapy, mindfulness, self-compassion, nervous system regulation, mind-body approaches. All of these may offer useful tools for some people. I have used and continue to use, and I teach many of these principles myself in gentle, careful, trauma-informed ways. But a tool is not the same as a complete explanation. A framework that helps one person should not be used to invalidate another person. A person who improves after using a particular program may sincerely feel that that program changed their life. That is wonderful, but it does not mean everyone else has the same problem, needs the same approach, or will recover only if they follow your path. This is where some people become unintentionally harmful. They recover or improve or find a concept that gives them hope or relief, and then they begin telling others, this is what is really happening to you, or you are not in withdrawal, it is actually your mind causing your symptoms, or you will only heal if you stop believing you are in withdrawal, or if you keep identifying with what you're going through, you will stay stuck. That can be deeply distressing for someone who knows their symptoms began after dose reduction, cessation, adverse reactions, kindling, tolerance, or medication changes. Or for someone who tries what is suggested and does not have a similar outcome. So in those instances, it can feel like gaslighting, or for those who don't have a similar outcome, it can be extremely distressing. This healing process and mind-body concepts can coexist. I do not believe we need to reject all mind-body ideas, nor do I believe we need to reject neuroplasticity, nervous system regulation, or trauma-informed practices. These can be helpful, especially when presented gently and without blame. But we must be careful. It is possible for someone to be in the throes of prescription-induced neurological dysfunction and also benefit from calming the nervous system. It is possible for someone to have a prescribed drug injury and also develop distress, terror, hypervigilance, trauma responses, or conditioned associations as a result of prolonged suffering. It is possible for mind-body practices to support coping without claiming that the entire condition is a result of unresolved trauma or that it's all in the head. It is possible for neuroplasticity tools to help someone live through withdrawal without implying that their symptoms are self-created, learned, imagined, or maintained by wrong thinking. These distinctions matter. When they are lost, people are harmed. Anecdotal experience matters. Science matters. Research matters. Clinical knowledge matters. But in emerging or poorly understood areas, long-term anecdotal evidence also matters. When thousands of people describe similar patterns over many years, we should not dismiss that simply because the research has not yet caught up. When experienced withdrawal-informed practitioners observe that certain messages destabilize people, that matters. When people repeatedly report that they were harmed by being pushed into expensive protocols, excessive supplements, overly stimulating practices, or frightening interpretations, we need to listen. Anecdotal evidence is not perfect. It has limitations, but it is not worthless. In communities where formal recognition has lagged behind lived experience, anecdotal knowledge has often been the first source of protection. I also worry about the financial commitments that many of our vulnerable people are making in an effort to find a cure. When someone is suffering intensely, they may be willing to try anything. They may spend money they do not have on treatments, therapies, testing, supplements, detoxes, IV therapies, stem cell treatments, protocols, programs, or practitioner packages, hoping that the next intervention will finally bring relief. Some of these may help a little, some may help quite a bit, some may do nothing, some may worsen symptoms, some may simply drain a person's finances and leave them feeling even more vulnerable, even more hopeless. Again, this is not about condemning any practitioner or any modality. It is about asking for caution, honesty, and humility. No practitioner should exploit desperation. No one should present an expensive intervention as the missing key for everyone. No one should imply that people are failing to heal because they have not bought the right program, taken the right supplements, detoxed the right toxins, released the right trauma, or believed the right theory. We need safer advice and safer receiving. This responsibility goes both ways. Those giving advice need to be more careful. Those receiving advice also need to practice discernment. If you are prescribed drug injured, especially if you're severely symptomatic, please remember that not every confident voice is a safe voice. Not every scientific sounding explanation applies to you. Not every story is your roadmap. Not every supplement list is relevant. Not every program is suitable for your current state. Not every practitioner understands withdrawal sensitivity and safeguarding. Not every theory deserves your nervous system's full attention. Before taking advice, pause if you can. Ask, does this person understand my experience? Do they understand akathisia, terror, and suicidal ideation as possible symptoms? Are they truly listening? Are they speaking with humility? Are they making frightening predictions? Are they offering one-size-fits-all certainty? Are they selling something? Do I feel calmer and clearer after reading or listening to them, or more terrified and pressured? Can I discuss this with someone grounded before acting on it? Discernment is protection. My plea to professionals, influencers, if you are a doctor, a therapist, a coach, a practitioner, a researcher, a program creator, or content creator speaking about prescribed drug injury, please be careful. Please do not make hopeless predictions. Please do not tell people they cannot heal. Please do not reduce every case to trauma, the mind-body connection, fear or terror, limbic impairment, inflammation, toxicity, methylation, gut health, mindset, or any single mechanism. Please do not present speculation as fact. Please do not use your authority to frighten people into buying something. Please do not shame people for not improving through your preferred approach. Please understand that most of the people you support are highly vulnerable and may be closer to giving up on healing than you realize. And please remember that safeguarding is not optional in this field. It is imperative. What people need most. People healing from this experience need accurate information. Yes, they do. But they also need groundedness. They need reassurance without false promises. They need validation without catastrophizing. They need options for coping, but without pressure. They need hope without hype. They need science with humility. They need lived experience with discernment. They need support that does not exploit their fear. They need to be reminded that even those who had severe, frightening, prolonged symptoms eventually healed, even after believing they never would. They need to know that the body is not a machine that can be forced, hacked, detoxed, retrained or argued into healing on command. It is a living system seeking balance. Sometimes our role is to support it gently, reduce unnecessary stressors, take sensible action, and keep going one moment, 1 hour, 1 day at a time. Of course, if you have a medical condition or a deficiency that needs to be addressed, you must seek medical treatment. What I am referring to is people being goaded or scared into having unnecessary treatment that could interfere with the unfolding of their healing. My concern is not theoretical. I hear from people who are terrified. I hear from people who have spent large amounts of money with promises and feel no better. I hear from people who have been told things that have left them hopeless. I hear from people who are trying desperately to hold on. I spent a lot of time crisis managing, just people, not clients, just people who get in touch with me scared, really petrified by what they're told. Some of the most vulnerable people in this community are not just confused by unsafe messaging, they are destabilized by it. That is why I'm sharing my concerns here, not to attack anyone or any specific modality, not to dismiss helpful tools, not to deny complexity, but to ask for more care, more humility, more safeguarding, more discernment, more awareness of the impact of words, more respect for the vulnerability of the people reading, listening, and trying to survive. Our community does not only need more information, it needs safer information. It needs people who understand that hope is not irresponsibility. Hope, when offered carefully and honestly, can be a form of protection. It can save someone's life. And for those of you who are having a difficult time right now, please know that you're not required to solve everything today. You do not have to chase every theory, buy every protocol, or make sense of every argument online. You are allowed to step back. You are allowed to protect yourself, to protect your mind. You are allowed to choose. You are allowed to return to what helps you get through the next moment safely. Your story is not over because someone frightened you. Your body will not stop working towards re-establishing homeostatic equilibrium. It will always continue to seek balance. And even if all you can do today is hold on, that matters. Please hold on. You are worthy of safe and responsible support, careful words, and hope that does not harm you. For more than 20 years, I've watched people who were convinced they would never heal go on to fully heal. It has been a privilege to do so, and I thank all of you who have trusted me to hold your hand as you heal. Thank you for being my teachers. Keep holding on, everyone, sending you much encouragement, warmth, and compassion. Lots of love from me. Bye.